If you experience intense emotional pain from perceived criticism, you might be facing rejection-sensitive dysphoria. Today, we are exploring what is rejection-sensitive dysphoria, ADHD. We will uncover its science and show you exactly how to deal with rejection-sensitive dysphoria. To understand this condition, we first need to look at the rejection-sensitive dysphoria meaning. Unlike typical disappointment, rejection-sensitive dysphoria with ADHD triggers an extreme autonomic nervous system response. Your brain misinterprets mild feedback as a severe physical threat to survival. What are the primary causes of rejection-sensitive dysphoria? Neuroscience suggests it stems from atypical dopamine routing in the neurodivergent brain. Because ADHD brains process reward and regulation differently, any perceived social rejection bypasses logical filters, crashing directly into the emotional processing centers. Let's clearly outline the rejection-sensitive dysphoria symptoms. You might feel sudden, overwhelming rage, profound sadness, or intense anxiety when you feel criticized. These symptoms of rejection-sensitive dysphoria hit instantly, completely overwhelming your rational mind and leaving you feeling utterly exhausted. A strict rejection-sensitive dysphoria definition highlights that the trigger does not even need to be real. A delayed email, an ambiguous text message, or a minor change in tone can initiate the exact same devastating emotional cascade as a major personal betrayal. The connection between ADHD and rejection-sensitive dysphoria is profound. Nearly all adults with ADHD report experiencing these intense emotional spikes. It creates a cycle of people-pleasing or extreme avoidance, where you preemptively withdraw from opportunities just to protect yourself from potential emotional pain. Having rejection-sensitive dysphoria explained through neuroscience helps remove the shame. You are not overly sensitive or simply overreacting. Your neurological hardware is literally amplifying the signal. Recognizing this biological reality is the essential first step toward effective rejection-sensitive dysphoria treatment. So how do we intervene? The foundation of treatment for rejection-sensitive dysphoria often starts with medical consultation. Alpha agonists, typically used for blood pressure, have shown remarkable success in lowering the physiological reactivity, giving your brain a crucial buffer before the emotional spike. Beyond medication, learning how to manage rejection-sensitive dysphoria requires tactical psychological tools. When the emotional wave hits, your immediate goal is to pause the physiological response. This means actively disengaging from the trigger and shifting your physical state to interrupt the nervous system. To master how to treat rejection-sensitive dysphoria behaviorally, you must practice cognitive distancing. When triggered, visualize the emotion as a separate wave passing over you, not as your core identity. Write down the trigger to move the processing from the emotional amygdala to the logical prefrontal cortex. Another highly effective strategy for how to overcome rejection-sensitive dysphoria involves creating an evidence log. Because your brain defaults to catastrophic assumptions, you need concrete proof of your competence. Document your successes, positive feedback, and moments of resilience to counter the negative bias. Let's discuss communication. When dealing with rejection-sensitive dysphoria, ADHD, clearly explaining your neurological triggers to trusted colleagues or loved ones can be transformative. Ask them for explicit clarity in their feedback, eliminating the gray areas where your brain typically invents catastrophic narratives. Physical regulation is also vital when learning how to deal with rejection-sensitive dysphoria. Because this condition mimics a physical trauma response, interventions like deep somatic breathing, intense short-burst exercise, or cold water exposure can quickly reset your vagus nerve and restore baseline calm. Building a robust emotional armor requires recognizing your internal warning signs. Before the full symptoms of rejection-sensitive dysphoria manifest, you might notice a tightening in your chest or shallow breathing. Catching these physical cues early allows you to deploy coping mechanisms proactively. Remember, rejection-sensitive dysphoria treatment is not about eliminating emotions entirely. It is about reducing the duration and intensity of the spike. By combining physiological tools, cognitive reframing, and proper medical support, you can significantly diminish the impact these episodes have on your daily life. It is also crucial to curate your environment. To effectively manage how to treat rejection-sensitive dysphoria, limit your exposure to highly critical or toxic spaces. Surround yourself with supportive networks that understand your neurodivergence and provide constructive, clear, and empathetic communication. Navigating ADHD and rejection-sensitive dysphoria is a journey of self-compassion. The intensity of your feelings is a reflection of your neurology, not a character flaw. Acknowledge the pain when it happens, use your management tools, and grant yourself the grace to recover slowly. Ultimately, understanding the rejection-sensitive dysphoria meaning empowers you to take back control. You possess a uniquely wired, highly perceptive brain. By mastering your emotional regulation, you can transform this intense sensitivity into a profound strength, driving empathy, deep connections, and remarkable personal growth.